Um, Labeling challenges in the life sciences industry is obvious to anyone who's probably listening to this because it is a target audience. And I think that one of the main label challenges in the life sciences industry is that labeling is often treated as an afterthought to an enterprise deployment. A company gets their MES or their PLM and their ERP, and they say, oh, we've got to put stickers on boxes. And then by that point, it's a little bit too late because you've got customer specific requirements, you've got local and regional requirements, even changed languages. You need to have validated environments, obviously. One of the high concepts that we're talking about here, electronic delivery IFUs, regulatory requirements, workflows and pieces like that. And so deciding what you're going to do for labeling after you have already talked about an enterprise architecture, it's too late. And so a lot of companies that we deal with are in this environment now. They either have multiple systems, as I talked about before, so they don't have a single version of what they're looking at, or they have older systems because they've been delayed in validating. And so I think Johnson's going to take us through a case study that has all these concepts and issues all kind of wrapped up into one that we were able together as partners help solve for our customers. So Johnson, take it away.
Thank you, Carter. I appreciate y'all. We're going to go right into our exciting use case. We had a mutual client in the life sciences. We're going to go through that use case. So we're going to give you a brief description of the client, the profile, the project's problem statement. And then we're going to go through the selection process, why the client chose Loftware, as well as why they chose Compliance Group, CG. We're going to look at CG's value-added services that were provided. We're also going to look very closely at the synergy and the partnership that we have in action. And lastly, we will highlight the takeaways from the project, as well as the benefits. So we'll go to the next slide. So our client is a well-established global medical device company with a market capitalization of over 20 billion, thousands of products in the world. So they are a big player in medical devices, and also because of all those products, they have a massive amount of labeling that is required. So not only are labels individually important, now we're speaking about massive volumes of labels that are important. So collectively, it's a big compliance responsibility. So they've got to be subject to all the regulations from the regulatory governing bodies. Next slide. Problem statement. Our client had been using an existing labeling software system that they had deemed outdated. And what I mean by that is it was an on-premise solution that didn't have strong fundamentals as far as label design, out-of-the-box functionality. So key thing was that they didn't have solid integration with other enterprise systems, often requiring custom software. So the client was then forced to transfer data manually across systems, and that resulted in a high likelihood or risk for human error. Also, the time that it took for that manual labor and the costs associated with that became a burden to the client. But most importantly, the change management of so many labels was crippling due to the existing labeling software's limitations, and again, poor out-of-the-box functionality. So with the next slide, we'll go to why the client selected Loftware. So Loftware is a global leader in label management solutions, and they have very powerful tools and functionality in all their labeling software. In particular, the cloud offering which is Loftware Enterprises Spectrum. They have the building blocks for very powerful and flexible label design with template, having multi-layer functionality, and also the ease of use as far as the interface, as well as mapping data from source systems of truth to the target label object. Also, the out-of-box functionality, there was very solid label artwork workflows, and also version control with role-based security to take that artwork and design it, and then approve it, and yet another party publish that into the production environment. So demonstration that the label workflow is under control, as well as its versions. And again, I had mentioned the advantage of the integrations with the common enterprise systems. Also, Loftware is 21 CFR Part 11, Annex 11 compliant, that highlighting electronic security, electronic records, electronic signatures, audit trails, and role-based access. Also, the Loftware SaaS offering, the advantage is the clear advantage is that the infrastructure and the maintenance is not the responsibility of the client, so they don't have to bear any of that overhead and burden, and becomes and is the responsibility of Loftware. I would like to add that Loftware is also ISO 9000 certified, so they have a robust quality management system, and also they are SOC 2 Type 2 certified, and so their information systems and their practices are compliant with maintaining data security, data privacy, data confidentiality, processing integrity, and availability. We'll go to the next slide. So here is the client's selection of CG. CG, as David mentioned, co-founders of CSA, and we have an arsenal of subject matter experts in the areas of validation, labeling compliance for all of life sciences and medical devices. We just to name a few, the governing bodies, obviously FDA with Drug Supply Chain Security Act, serialization, track and trace, and also UDI, medical devices, unique device identifier labeling. We also have subject matter expertise in MDR, which is the EU, again, with UDI labeling. Then we also have an expertise in ISO standards, in particular, the symbology that is standard globally for medical device labeling. And lastly, compliance for GS1, Global Standards 1 organization, to ensure that the elements in a label, in particular the barcodes, are compliant. This would be for linear barcodes, for data matrix, or we're looking at how the data is encoded with application identifiers. We're looking at the human readable interpretations, the HRI, which is the representation of what's encoded in the barcode. And so things of that nature, very important. And lastly, we also have expertise in labeling design best practices. So we work with the client, and we offered our best practices and expertise in labeling design, which were well taken by the client. We'll see the fruits of that later. And lastly, we have a multitude of successful end-to-end projects where we've delivered complete validations for Loftware and other SaaS solutions. Next slide. So this is just a quick dashboard of the CG value-added services provided. We performed a gap analysis for the client. We looked at their as-is labeling, and we critiqued it in a manner that would be addressed later on, and there'll be another slide to discuss that. But the next thing is we also had shared our industry best practices for labeling design. Also, we critiqued and ensured the labels were compliant with 21 CFR Part 11 and Annex 11, and we demonstrated that compliance for the specific client use case. We also offer the modernized risk-based framework approach, as David was saying, CSA, and we're looking at modernized ways to assess periodic releases. So for release management, it's very key. And again, we are looking to focus on that which affects patient safety, product quality, and data integrity. And then we also applied critical thinking, which is a major component of CSA throughout the project, provided a complete set of software development lifecycle documents and CSA deliverables. And I just wanted to add that, as David had mentioned, it's not about the volume. So I use this acronym. It's called VAV, and VAV stands for value added validation, and it is not volume added validation. So I just wanted to kind of put that in there. Next slide, please. So here is the partnership that we have in action. So CG and Loftware, we had an engaged team deploy a very powerful label design tool. And the design tool was that powerful template with the multi-layer functionality. And also the design approach was to organize and sort all the labels of the same size and background layout. Okay, I call this, it's all about size and location, location, and location. So those were grouped to one template. So one template would have the same label objects that we populated with data coming from the various sources of truth or enterprise systems. So basically, we're looking at leveraging the powerful and flexible structure of the Loftware template and its out-of-the-box tools to streamline label change management, as well as just group everything and consolidate everything instead of having individual labels, hundreds and thousands of labels all over. We're looking more at 100 templates or so or less. The other portion of this partnership is we achieved a streamlined validation where we validated the process and not the individual labels or the templates. So the main benefit of that is, if there are changes of values to the data, they still are subject to change management, but it's just a master data change that you update in one cell. Let's just say for one data point, you update it in one cell of a source of truth, and you're done, because the template and the validation is maintained, is not changing whatsoever. So that, as mentioned before, will lift the crippling and debilitating change management off of the client, has and did lift it off of the client, and can do so for other prospective clients. Next slide. So just want to highlight the key takeaways of this project and its benefits. So we have enhanced compliance of the labels because of that gap assessment that we did on the as-is labels. And then we addressed some of the more immediate high-risk items, again, patient safety, product quality, and data integrity in this project. And also, the client had a list of other gaps that had lesser risk and lesser priority, and they included that as a plan to deploy those remaining gaps in future phases. And that's just great to have when an auditor or regulator comes to a life science company and says, let me see your labels. Well, you have these issues here. What are you doing to address it, or what have you done to address it? And so now you have a plan. So that'll surely keep them off your back as far as observation or citation. The next thing is there's significant decrease in the volume of chain controls. Due again to we're handling the data changes as master data changes, and again handled by change management, but not nearly as burdensome as changing hundreds and thousands of labels impacted by the same common change. So we're looking at change management for data changes only as master data changes, and not the process that was validated. That's a key streamline approach to validation. Next, we eliminate the human error associated with the manual data transfer of the existing system, and we have improved central management of symbols and glyphs in a central location in the cloud. The other benefit clearly was the effective data mapping of the label templates to the respective sources of truth from the respective enterprise systems. And while doing that, it also enhanced data integrity and maintained the sources of truth as far as the data. That's a wrap on that slide, and thank you very much.